Turns out, heat, work, and the climate reckoning. Japan just discovered that telling people to drink more water might not be enough to save them from boiling alive at work. And here's the weird part. They had to build a mathematical model predicting ambulance rides over the next few decades just to figure that out. So the question becomes, if preventive measures can't keep pace with how fast the planet is heating up, what exactly are we supposed to do? Let's back up. For years, occupational health experts have operated under a pretty straightforward assumption. If we just educate workers about heat safety, give them better gear, and have employers enforce good practices, we can basically engineer our way out of heat-related illness. It's a tidy solution. Preventable problem, preventable solution. But something started feeling off around 2024 and 2025 when Japan noticed something alarming. Heat-related ambulance transports weren't declining, despite all these interventions rolling out. They were staying stubbornly high, and forecasts suggested they'd get worse. A lot worse. That's when researchers at Kyoto University's Center for Health Security decided to actually quantify something that sounds obvious but had never been properly measured. Given the climate we're heading toward, how much can these preventive behaviors actually help? Satoru Yurugi and Hiroshi Nishiura led this research, published in May 2026 in Epidemiologia. These aren't fringe researchers. Nishiura especially has spent years modeling infectious disease spread, so he understands how to take complex environmental data and turn it into human consequences. Their institution, the Center for Health Security at Kyoto University's Graduate School of Medicine, sits at this unusual intersection of epidemiology, climate science, and occupational health. The timing matters. Japan had literally just mandated preventive countermeasures for outdoor laborers in June 2025, which meant this study was essentially asking the question policymakers needed answered: did we do enough? Here's what they actually did. Yurugi and Nishiura took something called wet bulb globe temperature. Think of it as the single number that captures how hot it actually feels when you factor in heat, humidity, wind, and sun exposure all together. It's the metric that determines whether your body can shed heat anymore. They then used decades of climate data to project forward, essentially asking, how many ambulance calls for heat-related illness should we expect in Japan's working population over the coming years? To do this, they built statistical models linking wet bulb temperatures to actual ambulance transport records. Then they went out and did a cross-sectional survey, basically asking actual workers which preventive behaviors they were doing and whether it seemed to help. The 4 behaviors they focused on were straightforward: regular hydration, wearing an air-cooling vest, checking your own health before work, and recognizing warning signs. Think of it like building a simulation of reality, then testing what happens when you dial up how many workers follow the rules. The results were sobering, though not in a way that completely dismisses prevention. They projected that many future years would see more heat-related ambulance transports than the baseline years they were comparing to. That's the straightforward bad news. Climate change is outpacing our current interventions. But then they tested scenarios. What if workplace managers could somehow get adherence to all 4 preventive behaviors, up from the current level? Only 23% of workers doing all 4 to 34%. Then 45%. Then 91%, which would require a 300% increase relative to baseline. Here's where it gets interesting. Even at the most optimistic scenario, even if you could somehow get 9 out of 10 workers doing all 4 things perfectly, heat stroke risk didn't disappear. The ambulance calls would decline, yes, but the climate change effect was still larger. Prevention helps. It definitely helps. But it doesn't fully compensate for the warming. And that's the finding nobody wanted, but everyone needs to understand. Let's talk about what this means in human terms, because this isn't abstract. If you're a construction worker or agricultural laborer in Japan right now, this research is basically saying your employer can give you all the cooling vests in the world, mandate water breaks, do everything right, And you're still going to face increasing heat stress over the next decade because the environment is changing faster than adaptation can keep up. That doesn't mean the vests are useless. At current intervention rates, preventing even 10% of heat-related ambulance calls is meaningful. That's hundreds of people not having a medical emergency. But it also means that adaptation by individual behavior change hits a ceiling. This is important because there's a psychological trap in climate adaptation. We can convince ourselves that if everyone just tries harder, we'll be fine. This research politely but firmly says, no, that's not how this works. There are physical limits to how much sweat your body can evaporate when the wet bulb temperature exceeds certain thresholds. No amount of personal responsibility changes thermodynamics. The limitations are worth naming. This is Japanese data applied to Japanese working conditions, so it might not generalize perfectly to, say, a construction boom in the American Southwest or agricultural regions in India, where different populations might have different baseline health status, different work practices, different access to cooling technology. The survey data on intervention effectiveness comes from observational research, not randomized trials, which means there could be confounding variables. Maybe people who wear cooling vests are also the type who take health seriously in other ways. And the study makes assumptions about how intervention coverage could realistically increase, which is as much a political and economic question as a scientific one. This research sits at a fascinating fault line in climate science. For years, the conversation has been split between mitigation, stopping climate change by reducing emissions, and adaptation, adjusting our lives to live with warming. Occupational health researchers naturally focus on adaptation because, well, the warming is already locked in. But this study reveals something uncomfortable. Adaptation has limits, especially at the scale of individual and workplace behavior change. Once you're talking about wet bulb temperatures exceeding human physiological capacity, no amount of hydration or cooling vests can fully compensate. That suggests that serious heat adaptation for working populations might require bigger interventions, restructuring work schedules entirely to night shifts, redesigning industries to be less dependent on outdoor labor during summer months, or massive infrastructure investment in workplace cooling. Those aren't behavioral interventions, they're systemic ones. What comes next probably involves researchers testing whether different types of interventions, structural, technological, policy-based, can actually move the needle on adaptation. Someone should probably also study whether workers can realistically maintain perfect adherence to 4 preventive behaviors simultaneously when temperatures are climbing and employers are also concerned about productivity. And there's the uncomfortable question lurking behind all of this. At what point does adaptation become impossible, and we have to reckon with the fact that some work might become unsafe to do during some seasons in some places, period? Turns out, scientists have been busy, and they're not done yet.